Hello, my name is Jaron Kojo from Group B. Today my group will be presenting on first aid. The other members in my group include Sean Rush, Nazimak, and Tristan Kalis. Definition of first aid. When you provide basic medical care to someone experiencing a sudden injury or illness, it is known as first aid. In some cases, first aid consists of the initial support provided to someone in the middle of a medical emergency. This support might help them survive until professional help arrives. In other cases, first aid consists of the care provided to someone with a minor injury. For example, first aid is often all that we need to treat minor burns, cuts, and insect stings. 3 steps for emergency situations. If you encounter an emergency situation, follow these 3 basic steps. 1. Check the scene for danger. Look for anything that might be dangerous, like signs of fire, fallen debris, or violent people. If your safety is at risk, remove yourself from the area and call for help. If the scene is safe, assess the condition of the sick or injured person. Don't move them unless you must do so to protect them from danger. 2. Call for medical help if needed. If you suspect the sick or injured person needs emergency medical care, tell a nearby person to call 911 or the local number for emergency medical services. If you are alone, make the call yourself. 3. Provide care. If you can do so safely, remain with the sick or injured person until professional help arrives. Cover them with warm blankets, comfort them, and try to keep them calm. If you have basic first aid skills, try to treat any potentially life-threatening injuries they have. Remove yourself from danger if at any point in the situation you think your safety might be at risk. First aid for burns. If you suspect that someone has a 3rd-degree burn, call 911. Seek professional medical care for any burns that cover a large area of the skin, are located on a person's face, groin, buttocks, hand, or feet, have been caused by chemical or electricity.
First aid for burns. To treat a minor burn, run cool water over the affected area for up to 15 minutes. If that is not possible, apply cool compression to the area instead. Avoid applying ice to burn tissue, it can cause more damage. Over-the-counter pain relievers can relieve pain. Applying lidocaine or aloe vera gel, if not available cream, can also reduce discomfort. To help prevent infection, apply an antibiotic ointment and loosely cover the burns with clean gauze. Lastly, find out when you should contact the doctor for follow-up care. First aid CPR. If you see someone collapse or find someone unconscious, the first thing you want to do is call 911. If the area around the unconscious person seems safe, approach them and begin CPR. Even if you don't have formal training, you can still use hand-only CPR to help prevent someone from dying. Here's how to treat an adult with hand-only CPR. Place both hands on the center of their chest with one hand on top of the other. Press straight down to compress their chest rapidly at a rate about 100 to 120 compression per minute. Compress the chest to the beat of Stay Alive by Bee Gees or Crazy in Love by Beyonce can help you count at the correct rate. Continue performing chest compressions until personal help arrives. You never know when you might need to provide basic first aid. To prepare for the unpredictable, consider storing a well-stocked first aid kit in your home or car. It can also be a good idea to have a first aid kit available at work. You can buy standard first aid kits from many first aid organizations, pharmacies, or outdoor recreation stores. Alternatively, you can create your own first aid kit using products purchased from pharmacy. A standard first aid kit should include adhesive band of assorted size, roller band of assorted size, absorbent compression dressing, sterile gauze pad, adhesive cloth tape, triangular bandage, antiseptic wipes, aspirin, acetaminophen or ibuprofen, antibiotic ointment, hydrostone cream, calamine lotion, nitrile or vinyl gloves, safety pin, scissors, or tweezers.
A standard first aid kit should include acetaminophen or ibuprofen, antibiotic ointment, hydrocortisone cream, calamine lotion, nitrile or vinyl glove, safety pins, scissor, tweezer, thermometer, breathing barrier, instant cold pack, blanket, first aid manual. It's also smart to include a list of your health care providers, emergency numbers, and prescribed medicine in your first aid kit. It is important to protect yourself from contagious illness and other hazards when providing first aid. To protect yourself, always check hazards that could put your safety at risk before approaching a sick or injured person. Avoid direct contact with blood, vomit, or other bodily fluids. Wear protective equipment such as nitrile or vinyl glove when treating someone with an open wound or breathing barrier when performing rescue breathing. Wash your hands with soap and water immediately after providing first aid care. In many cases, basic first aid can stop minor situations from getting worse. In case of a medical emergency, first aid might even save a life. If someone has serious injury or illness, they should receive follow-up care from a medical professional.